Great. Thank you. Well, many of you may be aware that this week is actually World Immunization Week, which aims to promote the use of vaccines to protect people from disease, people of all ages against disease. So it's a big initiative. Rotary certainly behind it. So I thought it'd be great to bring in someone on this topic to share some details with our organization. So we're very lucky to have Amy Wishner. She is a program director for the PA Immunization Coalition, as well as a director with the PA chapter for American Academy of Pediatrics. And she's going to be sharing a little bit about her organization, what their mission is, as well as some of the unique immunization challenges that are happening right now because of COVID. And she's going to share a lot of great details with us. So help me welcome Amy. Thank you for joining us.
Hi, everyone. Thank you. I'm so impressed with, excuse me, managing this many people on Zoom. Everyone's so polite and you're not interrupting each other. I mean, I'm very impressed. And this is the perfect meeting for me to have joined because I'm excuse me, I've been at the Pennsylvania chapter, American Academy of Pediatrics, for 23 years, working that whole time on immunization. And then since 1996, I'm sorry, not since 1996, since 2006, also on food insecurity. So, you know, that was really great to hear what is happening with the food pantry. And there's a lot happening with that in the pediatric practice setting as well. There are just sort of two sentences about that, in the primary care setting, there's more and more emphasis on what is called, and I'm not assuming anyone here is or isn't in the healthcare field, but what is they call social determinants of health, which includes, you know, housing, transportation, education, and also food security. And so they're starting to screen and refer, and there are a lot of issues around that, how to do that effectively, and then how to know what your local resources are. And the particular program I'm working on is really connecting local food pantries with their local primary care practices, because they see the same families, but they often don't really communicate with each other. But anyway, enough about that. Now on to immunization. And so I am both a staff person for the statewide Pennsylvania Immunization Coalition, and also I sort of do immunization initiatives at the PA chapter, American Academy of Pediatrics. So the Pennsylvania Immunization Coalition, there are 20 local coalitions in our state. And we do a variety of things where we do community outreach, we do different kinds of educational events, partnerships, things like World Immunization Week, Meningitis Day. Every disease has a day or a week, and we do various things around that. Education, we do a lot with media, advocacy, promoting family health, and also clinical support for pretty much pediatrics and family medicine. So, but all ages. So the part of my job involving immunization is all ages, even though I'm based at the PA chapter, American Academy of Pediatrics. And of course, I know, you know, I mean, I tell you, as I said, I've worked on immunization a long time, and so I'm well aware of all that Rotary has done. And, you know, it's just so fantastic. I mean, when I was telling just my family and, you know, friends who I spoke with in the past few days that I was going to be talking with you all tonight, and I said, you know, Rotary's been like the leading entity behind, you know, international elimination of polio. And, you know, a lot of people aren't aware of that. I tend to take it for granted because I, you know, I work in this area. So, you know, that's just so fantastic. Before I get into there are two sort of things that I thought I would talk about in terms of the impact that COVID-19 is having on immunization. And before I do that, I'm just going to say the names of the diseases that we prevent with vaccines now. So, of course, polio, measles, mumps, rubella or German measles, pertussis or whooping cough, meningitis, and there now 5 different strains and 2 different vaccines that prevent different types of meningitis, pneumococcal, various kinds of pneumococcal infection, influenza, diphtheria, tetanus, human papillomavirus, hepatitis A and hepatitis B, and varicella or chickenpox. So, you know, these vaccines prevent a lot of things that we don't see. And one of the things that you probably, I think has been in the media a fair amount is that if we didn't have influenza vaccine, what we're seeing with COVID-19 now is what we would see every year if we didn't have influenza vaccine. And even though our rates of immunization are pretty low for influenza still, it makes a tremendous difference given that we don't have to go through what we're going through now. The two things that are happening that I thought it would be interesting, you might be interested in. One is the Centers for Disease Control and Prevention, or CDC, and the National American Academy of Pediatrics, which are the two entities that make recommendations for immunization. They have a joint, and they generally will make the same recommendation. And they have recommended that primary care sites prioritize immunization for children up to age 2. So that is to get sort of the first basic series of vaccines in. And really, a lot of those happen before about 15 months of age. So one is, okay, so, is that even happening? And I'm actually trying to find, that how we tell immunization rates in Pennsylvania, that is like a whole other challenge because we don't have a very good immunization registry for our state. In fact, we have one of the worst in the country for a variety of reasons. Philadelphia, on the other hand, has like the best immunization registry in the country. And by best, I mean what percent of providers participate in it because of how it's set up. So it can be challenging to even find out what's happening with immunization rates now. So I've been trying to find that out with the data that are in the registry by talking to the manufacturers and seeing what's been ordered, and by talking with the insurers to see what's being billed. So I do know that immunization rates are way down in the state and in the country as a whole. So even for those immunizations up to age 2, that people, as I'm sure a lot of you either have young kids or grandchildren. I heard, that talking before, and that people are afraid to bring their healthy kids in to a primary care site. And there are a variety of things that primary care sites are doing to address that parental concern. One is in group practices, they're having some offices be the offices that see sick kids and the other offices only see well kids. So really separating by space. Or the staff also may work in teams. And there's also, as you've been hearing about telehealth, there's an emphasis on doing part of the visit by telehealth. And so the part where the parent has to bring in the child is maybe much shorter and can be focused on vaccines and maybe a height, weight check if there are particular issues that have to be addressed. So parent hesitancy, reduced recommendations by the places that make recommendations, and primary care sites, pediatric practices are seeing a drop of between 50 and 70% of patients. And some of the things that I heard some people talking about before, kids aren't getting as sick, they're not getting sports-related injuries, they're not getting concussions, they're not getting torn ACLs, they're not spraining things as much. And also they're not getting all the infectious diseases that you would get in childcare and in school. So, they're not getting as many colds, as many respiratory illnesses, they're not getting lice, they're not getting, all the kinds of things that bring kids into primary care site. So this is a huge financial issue for primary care sites. And as well, all these people who either under age 2, the parents are hesitant, so they're not bringing the child in, or over age 2, all those well visits are being pushed off. And they're being pushed off till it's hard to say when. And then when they do, let's just say, okay, June or July, August, we're trying to catch up. So that's obviously a huge volume of stuff to all be being done then. And, one of the things that may happen, and this is one of the things I wanted to mention to you just for you to have on your radar screen, is that it may be a situation where in our state and in other states, the school immunization requirements may be suspended. This is not something that the state is talking about overtly at the moment, but just because I work in this area, it's on my radar screen, wondering about that, because just seeing, what's happening with all this care being put off, and will it logistically all be able to be done in the summer? And, so I think those are just some things I wanted to kind of put out there. And, there are big implications to that when you say, as you probably know, just even for the work with the work you do on polio, because even polio, and I say even polio because it seems like such a dramatic disease, and so relatively recently, my parents' generation was, I'm of the generation that, I walked into the school gym and got the polio vaccine on the sugar cube. So it's not, that long ago that we had really active polio in this country. And of course, it still is in some places in the world. And, even with that, the only thing that worked in terms of raising our immunization rates even for polio were school immunization requirements. So it's very scary to me, this idea that all this care is being put off, that kids aren't being immunized, that, all the adolescent vaccines, meningococcal vaccine, pneumococcal vaccine, human papillomavirus vaccine, and even, the vaccines for the youngest kids, measles, mumps, rubella, varicella, polio, that all that isn't, all these rates are down. So I guess some of the takeaways would be, one, if you start to see data about what our immunization rates actually are, because as I say, we certainly don't have a national immunization registry, and our state registry has a lot more data from the public sector than from the private, and yet the majority of immunizations in our state are given in the private sector. Sort of pay attention to that, because those data should be, I expect, will be coming out in the media. And then also pay attention to if there's discussion about school requirements, and over the summer, is catch-up being done, and in your own families. I'm sure you'll be hearing about this, about, okay, we're going to run, our kids or our grandchildren's practice is going to run an immunization clinic, and they're going to have, a drive-through or parking lot or things they haven't done before, all of which require good communication, because you want to make sure what's ordered and what's needed is what's given. You want to make sure the cold chain is maintained, as I'm sure you all know from your experience with polio, how important that is. So, there's some significant challenges. So those are some of the things that I wanted to bring up, because they're sort of the current challenges. And so I'm interested if you have thoughts about that, responses, or questions.
If anybody has a question, just unmute yourself, ask the question.
I would like to know why things are better in Philadelphia than other places.
Why they have a better immunization registry?
Yeah.
They set up their registry initially to be able to accept immunizations in any format. So a practice could call them in, they could send them in on paper, and the staff at the Philadelphia Department of Public Health would do the data entry. And so they set it up, and they, at the same time as they said, we'll take immunizations in any form that you will send them to us. And if you don't have all the data, like let's say you have a child's name, date of birth, and the vaccine that was given, but you don't have the lot number and the expiration date of that lot, but you know what was given on that day. They would take whatever partial information you had. And so, and the same time as they did that, they also set up, the Board of Health passed a regulation saying all immunizations were reportable. Initially, it was just for children. Now it's all ages, and their immunization registry covers all ages. The state immunization registry, on the other hand, said, we will not take any data, we will not take any immunization record unless it has these, and I forget if it was like 9 elements, 11 elements. It was a large number of things that you had to have. Otherwise, they did not want the information. And they wanted you to do duplicate data entry. They wanted your practice to shut down their data entry billing system, all that, and go into their immunization registry. Whereas Philadelphia was very good about establishing downloads and establishing linkages in real time so that you could enter one time at your practice and it would go to your billing department, it would go to the immunization registry, and so there was not this duplicate data entry. And I'm sure, you probably all deal with data in some ways. You also know that anytime you're doing duplicate data entry is a good way to make mistakes. So the fact that the Philadelphia bent over backwards to provide, to make it all easy and seamless, and also had that law. And at the state, we do not have such a law, and really it's a good thing because it's not practical. If you see, thousands of children, the idea that you have to do duplicate data entry is both a time you could make lots of mistakes, and also it's not practical for staff to provide the staff to do that. So that's the sort of short story of why that happened. I mean, I don't know. That's the politics of it and why that was allowed to happen at the state. I can't tell you because I don't know. It never made sense to me. And I've worked on this issue a long time, and I've been at many meetings with the state registry. The last, we have an annual immunization conference, which of course had to get canceled for this year. But for last year, I talked to the immunization registry people for the state, and I said, if a practice wants to enroll, how long is it before someone will come and train them? And they said 2 years. So that idea, it's just like ridiculous. But anyway, hopefully it will be getting better. I don't know what to say about it. But it is very frustrating because anytime you want to know, like now, I would love to know, and Philadelphia can do it easily. They can pull out by age, by antigen, by any variable you want. And they also use their data to target. If they see a certain area is low, they can reach out to all the providers in that area and say, we see that you're really low on your male human papillomavirus vaccination rates. What is it you need? You need education, resources, community presentation. So they just have their act together in Philadelphia. I don't know what to tell you.
Thank you.
More than you wanted to know about that.
We have a question from Jeff. He posted on the chat. It's a question for Amy. Even today, vaccine tracking seems so sketchy. Are parents expected to know that list and track it themselves? Or is there some automated way to track and alert you what more immunizations you need?
Individual practices and do a very, very good job with it, because I agree, it's very complicated. Which is, the good part of being complicated is that we have vaccines to prevent all those diseases that I listed at the beginning. Isn't that fantastic? But you're right, as a parent, I think it's impossible to keep track of it. There are some great tools online, the Centers for Disease Control and Prevention, the American Academy of Pediatrics, Vaccinate Your Family. All these organizations have terrific parent-friendly immunization schedules you can look at online, and you can do that. But most practices keep very good track of it now, because with all the, I have to say, this is a big plus of the electronic records, is that it prompts, it prompts who's due, who's overdue, what should be, what's needed at this visit. Prior to COVID-19, and I'm sure we will get back to this, most practices, before they look ahead to who's coming in the next day, and they figure out, these are the vaccines that these children will need. And then also, when you go into the room, one of those things that happens on the computer screen is it pops up to remind the physician or the nurse practitioner or the physician's assistant that these are the 5 vaccines this person is due for today. So, the electronic records are just a huge help with keeping people up to date. But, for adults, as I said, for children, the school immunization requirements are what makes it happen. For adults, unless your employer requires vaccines, there really is no, and this is a big problem, is that there's no real system for adult immunization in this country. So there's nothing that particularly reminds you, except if your practice reaches out to you and says that. But for children, they get reminded every year what's needed for school entry and attendance.
Any other questions?
Yeah, I have one really quickly, and I apologize if I got lost in the conversation here, but you're saying Philadelphia's system is exclusively for pediatrics, or did I misunderstand?
No. The Philadelphia Immunization Registry is all ages, all providers, and immunizations are a reportable disease and condition in Philadelphia. For the state, there's a list of, I don't know how many things it is now, 40 something, I think, reportable diseases and conditions that if your healthcare provider, any healthcare provider sees a case of, I don't know, diphtheria, that has to be reported to the state health department. And in Philadelphia, immunizations, all ages, all vaccines. I don't think travel vaccines are reportable, so I shouldn't say all, but the routinely given immunizations are reportable to the Philadelphia Department of Public Health for Philadelphia providers, so that they get, and they have made the system work for everybody, so they get 100% participation.
If I can have a follow-up, and I'll make this quick. How willing has Philadelphia been to share with the rest of the state their system, and how willing has the state been to receive that information?
Yeah, it's the state. The Philadelphia is 100% willing to share it, and I'm sort of sorry we got on that tangent because. But,
that's okay. I don't mean to. Yeah. I work in Harrisburg and it frustrates me, so I understand completely what you're saying.
Yeah, because we have like a fantastic Secretary of Health. I think Rachel Levine is terrific. She's very articulate. She's out and about. She's takes questions. She's a great communicator. So there are many wonderful things at the health department. There's just a bit of a issue with the immunization registry, and the public health nurses I work with all over the state that I've worked with a long time on immunization are fantastic. So please don't misinterpret what I said there.
I'm not. Trust me, I'm not.
Yeah. I know I've taken quite a bit of your time. Thank you so much.
Thank you, Amy. I appreciate it.
And, if you have any other immunization questions or concerns, or you see things you think I should know about, because I'm only one person, so it's great when I hear things from the different local coalitions or the general public. Or also, if you have other, if you're connected with other Rotaries that you think would be interested in immunization presentation, I would be, I'd be delighted to do that.
Great, thanks.
Excellent.
Okay, I will sign off then, and thank you again.
Thank you, Amy.
Thank you, Amy. Great.
Thank you. Thank you.
Dan Brill, you're up. Joke of the day before we go.
What? I didn't know I was going to be on.
That's why I told you last.
Well, first of all, my joke skills were just coming into their own before all this happened, and now everybody wants to tell jokes. So it's not very fair. But my son asked me the other day why his sister's name is Paris. You may have heard this, but I told him because she was conceived in Paris. And he said, "Oh, thanks, Dad." And I said, "No problem, quarantine."
I knew you'd come through.
I just
Put you
didn't
on the
hit
spot on purpose.
I just did not hit the stop recording button fast enough.